Hello and welcome to our new topic. We will continue from where we left. So, let's start. The learning objectives are shown. Please take a look. Now, let's move on to the treatment of hyperthyroidism. The antithyroid compounds used clinically include the thioamides, iodides, and radioactive iodine. The thioamides methimazole and propylthiouracil are major drugs for treatment of thyrotoxicosis. The major action is to prevent hormone synthesis by inhibiting the thyroid peroxidase catalyzed reactions and blocking iodine organification. In addition, they block coupling of the iodotyrosenes. Additionally, propylthiouracil also inhibits the peripheral deiodination of T4 and T3. The optimum effects are seen after 3–4 weeks because hormonal synthesis rather than the release is affected. It takes 3 to 4 weeks before stores of T4 are depleted. The most common adverse effect is a maculopapular pruritic rash, at times with fever. Rare adverse effects include an urticarial rash, vasculitis, a lupus-like reaction, lymphadenopathy, hypoprothrombonemia, exfoliative dermatitis, polycerasitis, severe hepatitis, acute arthralgia. Most dangerous is acute granulocytosis. The reaction is usually rapidly reversible when the drug is discontinued, but broad-spectrum antibiotic therapy may be necessary for complicating infections. Colony-stimulating factors may hasten recovery of the granulocytes. Carbimazole is a prodrug that gets converted into methimazole. Being potent, methimazole remains the drug of choice. However, propylthiouracil is safe during first trimester of pregnancy and is preferred in those patients due to a black box warning of severe hepatitis. Although both may cause fetal hypothyroidism, propylthiouracil is transferred very slowly across the placenta and hence safer. Monovalent anions such as perchlorate, pertechnetate, and thiocyanate can block iodide uptake through competitive inhibition of the iodide transport mechanism. The major clinical use for potassium perchlorate is to block thyroidal reuptake of iodide in patients with iodide-induced hyperthyroidism, such as amiodarone-induced hyperthyroidism. Potassium perchlorate is rarely used because it is associated with aplastic anemia. Before the introduction of thioamides, iodides were the main drugs. Now they are used as adjuncts. The major action of iodides is to inhibit thyroxine release, possibly through inhibition of thyroglobulin proteolysis. Improvement in thyrotoxic symptoms occurs rapidly, within 2 to 7 days, hence useful in thyroid storm. In addition, iodides decrease the vascularity, size, and fragility of a hyperplastic gland, making the drugs valuable as preoperative preparation for surgery. The Wolff-Chaikoff effect is a temporary reduction in production of T3 and T4 following iodine exposure, acting as a protective mechanism to prevent excessive thyroid hormone synthesis. Iodism or transient hyperthyroidism may also be seen. Beta-ray emitting I-131 is the only isotope that is used in thyrotoxicosis. It leads to irreversible destruction of thyroid parenchyma. Within a few weeks after administration, destruction of the thyroid parenchyma is evidenced by epithelial swelling and necrosis, follicular disruption, edema, and leukocyte infiltration. Advantages of radioiodine include easy administration, effectiveness, low expense, and absence of pain. Fears of radiation-induced genetic damage, leukemia, and neoplasia have not been realized after more than 50 years. Beta blockers without intrinsic sympathomimetic activity, e.g., propranolol, metoprolol, atenolol, are effective therapeutic adjuncts in the management of thyrotoxicosis since many of these symptoms mimic those associated with sympathetic stimulation. To T3. Use propylthiouracil in first trimester of pregnancy. Methimazole can be used later on. Although more associated with hypothyroidism, sometimes hyperthyroidism can result with amiodarone. This often requires methimazole with glucocorticoids as treatment. And here is a review. Pause the video and take your time to grasp the facts. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!